Welcome to the 30 Days, 30 NCLEX Practice Test Challenge. Over the next 30 days, we're solving more than 2,000 real NCLEX-style questions. And if you stay committed and complete all 30 practice tests, there's a high chance you'll pass the NCLEX on your very first attempt. Today is day 5, and we're jumping into the 5th practice test, packed with high-yield questions that have challenged even top nursing students. The nurse is preparing the hospital room for a pediatric client who has just been diagnosed with celiac disease. The question is, which type of isolation or infection control precaution is most appropriate for this client? The options are as follows. Option A suggests droplet precautions. Option B recommends contact precautions. Option C proposes standard precautions. And Option D advises neutropenic precautions. The correct answer is Option C, standard precautions. This is because celiac disease is an autoimmune disorder triggered by an immune reaction to gluten, a protein found in wheat, barley, and rye. It is not an infectious condition and does not spread from person to person, which means transmission-based isolation is not necessary. Standard precautions, which include routine practices such as hand hygiene and the appropriate use of personal protective equipment depending on exposure, are sufficient. Let us now move on to question 2, which centers on prioritization in maternity nursing care. The charge nurse is reviewing a change of shift report on multiple maternity clients. Which client should the nurse prioritize for immediate assessment? The options are as follows. Option A discusses a postpartum client who delivered a term infant 2 days ago and reports sweating and increased urinary frequency. Option B involves a client who is 15 weeks pregnant and currently being treated for hyperemesis gravidarum, now reporting worsening nausea after eating. Option C presents a client who is 32 weeks pregnant with a known diagnosis of placenta previa, admitted 2 hours ago, and now complaining of increased lower back pain. Lastly, Option D features a laboring client in the first stage of labor whose most recent fetal heart tracing showed early decelerations. The correct answer is Option C, a client who is 32 weeks pregnant with placenta previa and new onset lower back pain. This client needs immediate assessment due to the concern for possible placental abruption, a serious complication. While placenta previa is typically associated with painless vaginal bleeding, the sudden onset of back pain could signal a premature separation of the placenta from the uterine wall. This poses life-threatening risk to both mother and fetus and warrants urgent evaluation of uterine tenderness, fetal heart tones, and maternal hemodynamic status. In contrast, options. Building on this clinical judgment framework, let us proceed to question 3, which addresses ethical care during end-of-life situations. The nurse is providing care to several clients nearing the end of life, many of whom are experiencing severe pain that is distressing both physically and emotionally for them and their families. According to the American Nurses Association, which statement best reflects its stance on pain management in end-of-life care? The choices are Option A, advocate for pain management unless life-threatening side effects occur. Option B, advocate for pain management even if life-threatening side effects may unintentionally hasten death. Option C, prohibit the use of respiratory depressing medications because it constitutes euthanasia. And Option D, allow families to administer respiratory depressing medications to accelerate death. The correct answer is Option B, advocate for pain management even if life-threatening side effects may unintentionally hasten death. The American Nurses Association supports the ethical principle of effective pain relief, even when it carries the potential risk of respiratory depression, as long as the intent is not to cause death. This is rooted in the concept known as the principle of double effect, where relieving suffering is the intended goal, and the hastening of death is an unintended secondary consequence. Continuing with pharmacological considerations during pregnancy, question 4 focuses on a client who is 6 weeks pregnant and concerned about continuing her prescribed antidepressant. The nurse must assess the client's understanding of antidepressant use during pregnancy. Which client statement demonstrates the most accurate understanding? Option A states, I will need to stop my antidepressant until after I've delivered. Option B suggests, I will not need an antidepressant while pregnant because pregnancy causes depression remission. Option C offers, I may have to switch to a new antidepressant while I'm pregnant. And Option D states, if I continue my antidepressant medication, I must undergo a cesarean section at delivery. The correct answer is Option C, I may have to switch to a new antidepressant while I am pregnant. This reflects appropriate understanding because while many selective serotonin reuptake inhibitors, such as sertraline and fluoxetine, are considered safe in pregnancy, others like paroxetine may pose risks and require substitution. Next, question 5 addresses prioritization of newly received prescriptions. The nurse must decide which order to implement first among newly admitted clients. Option A is to administer enoxaparin to a client with a platelet count of 165,000 per cubic millimeter. Option B is to administer warfarin to a client with an international normalized ratio of 2.4. Option C is to administer packed red blood cells to a client with a hemoglobin level of 6.1 grams per deciliter. And option D is to administer regular insulin to a client with a blood glucose level of 285 milligrams per deciliter. The correct answer is option C, administering packed red blood cells to a client with a hemoglobin of 6.1 grams per deciliter. This lab value is critically low and poses an immediate threat to oxygen delivery and tissue perfusion. Transfusion is life-saving and should be prioritized. Now let us examine question 6, which highlights diagnostic reasoning in obstetrics. A client presents to the emergency department with symptoms suggesting ectopic pregnancy. Which diagnostic test should the nurse anticipate being ordered? Option A is non-stress testing. Option B is an abdominal X-ray. Option C is a transvaginal ultrasound. And option D is a Doppler transducer. The correct answer is option C, transvaginal ultrasound. This imaging method provides the most sensitive and specific view of early intrauterine versus ectopic pregnancy. It can identify a gestational sac, yolk sac, or embryo, and determine if implantation occurred outside the uterus, often in the fallopian tube. Option A evaluates fetal heart rate in later pregnancy, not early diagnostics. Let us now move into question 7, which focuses on how nurses respond to critical laboratory values. The nurse is caring for a client when the laboratory department calls with a critical sodium level of 122 milliequivalents per liter. The question is, what should the nurse do first? Here are the options. Option A is to notify the primary healthcare provider. Option B is to implement seizure precautions. Option C is to read back the result for verification. And option D is to recollect the laboratory specimen. The correct answer is option C, read back the result for verification. Here is the rationale. When a critical lab value is reported, the nurse's immediate responsibility is to confirm the accuracy of the communication using a read-back protocol. This technique ensures closed-loop communication and is mandated by the Joint Commission to prevent misidentification and miscommunication. While notifying the provider and implementing precautions are crucial steps, none of them should occur before verifying the result. Verifying first protects patient safety and ensures interventions are based on accurate data. A sodium level this low can lead to serious complications like seizures or coma, but acting without verification could lead to medical errors. Are you ready to finally pass the NCLEX with confidence? Our complete NCLEX course is designed to give you everything you need to succeed. Whether you are starting your prep or need a powerful last-minute boost, you will get access to live classes led by expert nurses, 100 hours of animated crash course content, and over 500 hours of recorded lectures that you can watch anytime. We also cover 500 NGN-style questions in detailed lecture format, along with 5,000 previously asked NCLEX questions to ensure you are fully prepared. Plus, you will get 15 full-length CAT and mock tests that simulate the real exam experience. To support your study plan, we include an exclusive NCLEX ebook, PDF notes, and a personalized study planner for 1 week, 1 month, or 3 months, whichever suits your schedule. And with 1 full year of access after enrollment, you can study at your own pace without stress. This is your shortcut to NCLEX success. So do not wait. Enroll now. Link is in the description. Let us help you become the nurse you are meant to be. Shifting gears to question 8, this one evaluates the nurse's responsibilities during post-mortem care. The question reads, which action should the nurse take when performing post-mortem care? Here are the options. Option A is elevating the head of the bed for easier family viewing. Option B is performing mouth care to maintain oral hygiene. Option C is applying lotion to the skin to prevent post-mortem changes. And option D is removing identification tags before notifying the family. The correct answer is option A, elevating the head of the bed for easier family viewing. Here is the rationale. Elevating the head of the bed as soon as possible after death helps prevent facial discoloration and promotes a peaceful, dignified appearance. This supports the emotional needs of the family during viewing. Mouth care and lotion are not part of standard post-mortem care and do not affect the visual appearance significantly. Most importantly, identification tags must always remain on the client to avoid misidentification. Post-mortem care should also respect cultural beliefs, involve gentle closure of the eyes, and ensure that dentures remain in place to preserve facial shape. Next, let us review question number 9, which looks at physical assessment techniques used to evaluate eye function. The question is, to evaluate a client's eyes for accommodation, which of the following techniques should the nurse use? Here are the options. Option A, bring a pen light from the side of the client's face. Option B, ask the client to gaze at a distant object, and then shift focus to a nearby object. Option C, place a tuning fork in the center of the client's forehead. Option D, have the client stand 20 feet away from a Snellen chart. The correct answer is option B, ask the client to gaze at a distant object and then at a test object held nearby. Here's why this is correct. Accommodation refers to the eye's ability to adjust its focus between far and near objects. When functioning properly, the pupils constrict and the eyes move inward, a process called convergence. When focusing on something close, this test checks the function of cranial nerves 3, 4, and 6. Now, let's quickly look at why the other options are incorrect. Bringing a pen light from the side checks for the pupillary light reflex, not accommodation. Placing a tuning fork in the center of the forehead is the Weber test, which assesses hearing, not vision. And having the client read a Snellen chart checks visual acuity, not accommodation or pupil movement. Now let us move on to question 10, which highlights nutrition education for clients with anemia. The nurse is providing dietary education to a client recently diagnosed with iron deficiency anemia. The question asks, which of the following meal selections demonstrates correct understanding of the nurse's teaching? Here are the options. Option A is cucumber salad with shredded carrots and balsamic vinaigrette. Option B is an omelette with cheese and toast. Option C is lentil soup with garlic bread. And option D is beef liver with sautéed kale and wild rice. The correct answer is option D, beef liver with sautéed kale and wild rice. Here is the rationale. Beef liver is rich in heme iron, which the body absorbs most efficiently. Kale adds vitamin C, which boosts iron absorption, and wild rice contributes fiber and other minerals, making this a well-rounded choice. The other options are inadequate. Cucumbers and carrots are not iron-rich. The omelette and cheese do not provide enough bioavailable iron, and although lentils contain non-heme iron, their absorption is limited and not enhanced by garlic bread. Proper dietary education for anemia should focus on combining iron-rich foods with vitamin C and avoiding inhibitors like calcium or caffeine during iron-rich meals. Now, let us continue with question 11, which focuses on clinical prioritization during shift change on a medical surgical unit. The question asks, which client should the nurse assess first? Here are the options. Option A is a client being treated for chronic pulmonary emphysema with a partial pressure of carbon dioxide of 50 millimeters of mercury. Option B is a client with pulmonary tuberculosis refusing isoniazid. Option C is a client with a Clostridium difficile infection currently reporting dizziness. And option D is a client with acute pyelonephritis and a fever of 101.8 degrees Fahrenheit. The correct answer is option C, a client with a Clostridium difficile infection who is currently reporting dizziness. Here is the rationale. Dizziness in this context is not expected and may signal fluid volume depletion or electrolyte imbalance caused by diarrhea, both of which require urgent intervention. While the other clients have important needs, none present with symptoms suggesting imminent deterioration. The emphysema client's carbon dioxide level is stable for their condition. The tuberculosis client can be addressed later with education, and the pyelonephritis client's fever is a common, manageable symptom. Dizziness, on the other hand, could quickly escalate into hypovolemic shock if left untreated, making it the top priority. Moving on to question 12, we shift to discharge teaching following orthopedic surgery. The nurse is preparing to discharge a client after a recent knee arthroplasty. The question is, which instruction should the nurse include in the discharge education? Here are the options. Option A is that the client will use a wheelchair to get around. Option B says the client needs to resume prescribed anticoagulants. Option C recommends placing a pillow under the knee for pain relief. And option D states that icing the site for 1 hour at a time is appropriate. The correct answer is option B. You will need to resume your prescribed anticoagulants. Here is the rationale. Following knee arthroplasty, clients are at increased risk for blood clots due to decreased mobility. To prevent venous thromboembolism, anticoagulant therapy is resumed postoperatively and continued for at least 14 days. Wheelchair use is not typically needed. Early ambulation with assistance is encouraged. Placing a pillow directly under the knee may cause joint contractures, and ice therapy should be limited to 20-minute intervals, not 1 hour, to avoid skin injury. This question reinforces the importance of evidence-based post-surgical education to reduce complications and promote safe recovery. Let us now take a look at question 13, which addresses pre-procedure care for clients receiving epidural analgesia. The question reads, which prescription should the nurse expect to administer before initiating continuous epidural analgesia? Here are the options. Option A is lactated ringers, option B is ondansetron, option C is ketorolac, and option D is haloperidol. The correct answer is option A, lactated ringers. Here is the rationale. Epidural analgesia can lead to hypotension due to sympathetic nervous system blockade. To minimize this risk, the nurse should administer an isotonic intravenous fluid bolus, such as lactated ringers, beforehand. This expands blood volume and stabilizes blood pressure during the procedure. The other medications listed do not address this priority. Ondansetron is used for nausea, ketorolac is a pain reliever but not relevant in this setting, and haloperidol is used for psychiatric conditions, not for pain management or anesthesia preparation. The key takeaway is that fluid management is essential to prevent complications from regional anesthesia. Next comes question 14, which evaluates health promotion strategies for older adults. During a teaching session on improving sleep quality, the nurse asked the group to share their routines. The question is, which statement indicates the need for further teaching? Here are the options. Option A says that nicotine replacement gum may worsen insomnia. Option B states that daily naps should be limited to 30 minutes. Option C suggests that reading before bed may help with sleep. And option D says drinking a cup of hot green tea before bed is okay. The correct answer is option D, drinking a cup of hot green tea before bed is okay. Here is the rationale. Green tea contains caffeine, which stimulates the nervous system and interferes with sleep onset. Many clients mistakenly believe it is calming, but it can disrupt sleep if consumed at night. The other statements are correct. Nicotine can worsen sleep, short naps can prevent evening insomnia, and calm reading, without screens, can promote relaxation. This question highlights how detailed lifestyle education can correct misconceptions and enhance well-being in older adults. Finally, let us explore question 15, which deals with prioritizing assessments during initial morning rounds. The nurse must decide which client to see first. The question is, which of the following clients should the nurse assess first? Here are the options. Option A is a diabetic client scheduled for discharge today. Option B is a 32-year-old female with a tracheostomy who is experiencing copious secretions. Option C is a 16-year-old scheduled for physical therapy later that morning. And option D is an 80-year-old with a pressure ulcer needing a dressing change. The correct answer is option B, a 32-year-old female with a tracheostomy who is experiencing copious secretions. Here is the rationale. This scenario presents a potential airway emergency. According to the ABCs of prioritization, airway, breathing, circulation, the airway must always be addressed first. Copious tracheostomy secretions can lead to obstruction and respiratory distress. The other clients are stable and do not have urgent needs. The diabetic discharge can wait. Physical therapy is not time-sensitive. And the wound dressing change, while important, does not pose an immediate threat to life. This question reinforces rapid prioritization and critical thinking in acute care settings. Let us now turn to question 16, which challenges your fluid calculation skills based on intake and output documentation. The nurse is reviewing a client's intake at the end of a 12-hour shift and must determine the total fluid intake. The intake includes 3 8-ounce cups of water, 0.9% sodium chloride intravenously at 70 milliliters per hour for 12 hours, 500 milligrams of azithromycin reconstituted in 250 milliliters of 0.9% sodium chloride, and 5 milligrams of morphine sulfate diluted in 7 milliliters of 0.9% sodium chloride. The question is, what total fluid intake should the nurse document? Here are the options. Option A is 1,817 milliliters. Option B is 1,815 milliliters. Option C is 1,810 milliliters. And option D is 1,800 milliliters. The correct answer is option A, 1,817 milliliters. Here is the rationale. Each 8-ounce cup equals 240 milliliters, so 3 cups equals 720 milliliters. The intravenous fluid at 70 milliliters per hour for 12 hours equals 840 milliliters. Add the 250 milliliters from the azithromycin infusion and 7 milliliters from the morphine dilution. When summed, 720, 840, 250, and 7. The total intake is 1,817 milliliters. This question reinforces the importance of including all sources of fluid, including medication diluents, when documenting intake. Next, we move into question 17, which addresses therapeutic communication with a distressed parent. The question reads, a parent is sobbing at the bedside of their newborn, recently diagnosed with an omphalocele, and says, I cannot believe my baby was born this way. He will surely die. What is the most appropriate nursing response? Here are the options. Option A is, oh hush, this is not so bad. Option B says, I understand you are upset. This is certainly serious, but there is a treatment that can repair the omphalocele, and we will take excellent care of your baby. Option C is, your baby will not die. This can be fixed. And option D says, would you like to hold your baby while he is still here? The correct answer is option B. Here is the rationale. This response acknowledges the parent's emotions while offering realistic reassurance and information about treatment. It maintains therapeutic communication without giving false hope or dismissing the parent's concerns. Are you ready to finally pass the NCLEX with confidence? Our complete NCLEX course is designed to give you everything you need to succeed. Whether you are starting your prep or need a powerful last-minute boost, you will get access to live classes led by expert nurses, 100 hours of animated crash course content, and over 500 hours of recorded lectures that you can watch anytime. We also cover 500 nclex-style questions in detailed lecture format, along with 5,000 previously asked nclex questions to ensure you are fully prepared. Plus, you will get 15 full-length CAT and mock tests that simulate the real exam experience. To support your study plan, we include an exclusive NCLEX ebook, PDF notes, and a personalized study planner for 1 week, 1 month, or 3 months, whichever suits your schedule. And with 1 full year of access after enrollment, you can study at your own pace without stress. This is your shortcut to NCLEX success, so do not wait. Enroll now. Link is in the description. Let us help you become the nurse you are meant to be. Let us now review question 18, which involves priority nursing actions after a lumbar puncture. The question asks, which action should the nurse prioritize following a lumbar puncture in a client with suspected meningitis? The options are as follows. Option A is assess the gag reflex. Option B is elevate the head of the bed to 30 degrees. Option C is encourage oral fluid intake. And option D is assess for Brudzinski sign. The correct answer is option C, encourage oral fluid intake. Here is the rationale. After a lumbar puncture, encouraging fluid intake helps replenish lost cerebrospinal fluid and reduces the risk of post-lumbar puncture headache. The client should also remain flat for several hours. The other actions are not priorities. Assessing the gag reflex is unrelated. Elevating the head of the bed too soon may worsen headaches. And Brudzinski sign is a diagnostic test for meningitis done before, not after, the procedure. Now let us go into question 19, which centers on identifying risk factors for disseminated intravascular coagulation, also known as DIC. The nurse has completed an education session and must identify which client is most at risk. The options are, option A is a client with iron deficiency anemia receiving parenteral iron. Option B is a client being treated for gram-negative sepsis. Option C is a client with atrial fibrillation taking rivaroxaban. And option D is a client taking aspirin daily to reduce coronary risk. The correct answer is option B, a client being treated for gram-negative sepsis. Here is the rationale. Gram-negative sepsis is one of the leading causes of DIC. The bacteria release endotoxins that trigger a cascade of clotting and bleeding, using up platelets and coagulation factors. The other options involve conditions or medications that may affect bleeding but do not initiate the clotting pathway dysfunction seen in DIC. This question emphasizes the importance of recognizing systemic infections as serious precursors to life-threatening complications like DIC. Finally, let us examine question 20, which focuses on positioning to prevent nighttime asthma complications in a pediatric client. The question is, which position should the nurse recommend at bedtime to promote comfort and reduce respiratory risk in a child who had a severe asthma attack earlier in the day? Here are the options. Option A is high or semi-Fowler's position. Option B is prone position. Option C is side-lying position. And option D is supine position. The correct answer is option A, high or semi-Fowler's position. Here is the rationale. This upright posture helps expand the lungs, decrease airway resistance, and improve oxygenation. It also reduces the risk of nocturnal bronchospasm and airway obstruction. The prone and supine positions can compromise lung expansion, while the side-lying position is less effective than upright positioning in managing respiratory distress. This question reinforces the nurse's role in preventing complications by optimizing client positioning. Let us now begin with question 21, which centers on emergency assessment using basic life support principles. The nurse enters a client's room and discovers the client lying on the floor. The question is, what is the nurse's initial action? Here are the options. Option A is to assess the client's level of consciousness. Option B is to examine the client for injuries. Option C is to call the rapid response team. And option D is to palpate the client's carotid pulse. The correct answer is option A, assess the client's level of consciousness. Here is the rationale. According to the basic life support protocol, the very first action when encountering a collapsed client is to assess whether they are responsive. This determines the next course of action, whether to call for help, initiate cardiopulmonary resuscitation, or proceed with further assessment. Checking for injuries and activating emergency resources are important, but only after the client's responsiveness is evaluated. The BLS sequence begins with assessing consciousness. Only then can airway, breathing, and circulation be addressed appropriately. Now moving on to question 22, which focuses on medication safety and prescription verification. The healthcare provider is reviewing new medications for assigned clients, and the nurse must identify which prescription requires clarification. The question is, which of the following prescriptions should the nurse question? Here are the options. Option A is captopril for a client with congestive heart failure. Option B is metoprolol for a client with frequent premature ventricular contractions. Option C is verapamil for a client with atrial fibrillation. And option D is spironolactone for a client with end-stage renal disease. The correct answer is option D, spironolactone for a client with end-stage renal disease. Here's the rationale. Spironolactone is a potassium-sparing diuretic, and in clients with severely reduced kidney function, its use increases the risk of dangerous hyperkalemia. Clients with end-stage renal disease have diminished capacity to excrete potassium, so this prescription could result in life-threatening cardiac arrhythmias. The other medications are appropriate for their respective conditions and do not carry the same level of risk in this scenario. Nurses must always verify whether a prescribed drug aligns with the client's current renal function, especially when potassium balance is at stake. Let us proceed to question 23, which highlights nursing roles in interprofessional collaboration. The nurse is working with individuals both within and beyond the immediate work setting to reach shared goals and support clients. The question is, which role is the nurse primarily fulfilling in this scenario? The options are, option A is collaborator, option B is team leader, option C is delegator, and option D is manager. The correct answer is option A, collaborator. Here is the rationale. The role described involves shared decision-making and cooperation across departments or specialties. Collaboration in nursing means coordinating care with others, often physicians, therapists, or community providers, to ensure the best outcomes for the client. While team leadership, delegation, and management are all part of a nurse's scope, the scenario does not reflect administrative or supervisory duties. Instead, it emphasizes partnership and teamwork, which clearly points to the role of a collaborator. Next up is question 24, which focuses on pediatric immunization timing. The nurse is assessing a 4-day-old full-term newborn. The question is, Which immunization should the nurse expect to be recommended at this time? Here are the options. Option A is hepatitis A vaccine. Option B is hepatitis B vaccine. Option C is rotavirus vaccine. And option D is the diphtheria, tetanus, and pertussis vaccine. The correct answer is option B, hepatitis B vaccine. Here is the rationale. The hepatitis B vaccine is the only immunization routinely given during the newborn period, typically within the first 24 hours of life. It provides crucial early protection against a virus that can cause serious liver disease. Hepatitis A, rotavirus, and DTaP vaccines are all initiated later, usually beginning around 2 months of age or later. Nurses must understand vaccine schedules to ensure timely protection and proper parental education. Now on to question 25, which addresses recognition of respiratory emergencies. The nurse is assessing a client who sustained a blunt chest injury. The question is, which of the following assessment findings would most likely indicate a pneumothorax? The options are, option A is diminished breath sounds, option B is barrel chest, option C is bradypnea, and option D is pulse deficit. The correct answer is option A, diminished breath sounds. Here is the rationale. A pneumothorax occurs when air leaks into the pleural space, leading to lung collapse and impaired ventilation. This results in decreased or absent breath sounds over the affected area. A barrel chest is a chronic finding seen in conditions like chronic obstructive pulmonary disease, not acute trauma. Bradypnea is uncommon in pneumothorax, where rapid breathing is more likely. Pulse deficit relates to cardiac rhythm, not respiratory issues. Prompt recognition of diminished breath sounds helps ensure early intervention and preparation for procedures, such as chest tube insertion. Are you ready to finally pass the NCLEX with confidence? Our complete NCLEX course is designed to give you everything you need to succeed. Whether you are starting your prep or need a powerful last-minute boost, you will get access to live classes led by expert nurses, 100 hours of animated crash course content, and over 500 hours of recorded lectures that you can watch anytime. We also cover 500 nclex-style questions in detailed lecture format, along with 5,000 previously asked NCLEX questions to ensure you are fully prepared. Plus, you will get 15 full-length CAT and mock tests that simulate the real exam experience. To support your study plan, we include an exclusive NCLEX ebook, PDF notes, and a personalized study planner for 1 week, 1 month, or 3 months, whichever suits your schedule. And with 1 full year of access after enrollment, you can study at your own pace without stress. This is your shortcut to NCLEX success, so do not wait. Enroll now. Link is in the description. Let us help you become the nurse you are meant to be. Let us now review question 26, which involves physical assessment techniques using percussion. During a head-to-toe physical examination, the nurse performs percussion on various body regions. The question is, over which organ would the nurse expect to hear a tympanic sound? Here are the options. Option A is the stomach, option B is the liver, option C is normal lung tissue, and option D is tympany is an abnormal finding. The correct answer is option A, the stomach. Here is the rationale. Tympany is a high-pitched, drum-like sound, normally heard over air-filled structures like the stomach or intestines. It is not abnormal unless heard over areas where it should not occur, such as the liver or lungs. The liver should sound dull, and the lungs typically sound resonant. Understanding the sounds associated with percussion helps nurses assess for abnormalities, like fluid accumulation, masses, or organ enlargement. Continuing with question 27, we now focus on acute metabolic emergencies. The nurse is caring for a client diagnosed with hyperglycemic hyperosmolar state, or HHS. The question is, which prescription should the nurse anticipate receiving from the healthcare provider? Here are the options. Option A is 0.9% saline infusion, option B is glargine insulin, option C is sodium polystyrene, and option D is sodium bicarbonate. The correct answer is option A, 0.9% saline infusion. Here is the rationale. The priority in treating HHS is aggressive fluid resuscitation to correct profound dehydration from osmotic diuresis. Isotonic saline is administered first, often beginning with a 1-liter bolus. Although insulin is needed, it comes after fluids are restored. Sodium polystyrene is used for hyperkalemia, which is not typically present in HHS, and bicarbonate is more relevant in diabetic ketoacidosis, not HHS. Recognizing the treatment sequence is critical in managing this life-threatening hyperglycemic emergency. And finally, we reach question 28, which focuses on pharmacologic management in critical care. The nurse initiates a prescribed dopamine infusion. The question is, what is the primary therapeutic goal of this medication? Here are the options. Option A is to dilate peripheral blood vessels. Option B is to reduce myocardial oxygen demand. Option C is to enhance sodium and water retention. And option D is to increase cardiac output. The correct answer is option D, increase cardiac output. Here is the rationale. Dopamine is a vasopressor used to treat hypotension, shock, and low cardiac output states. It stimulates beta-1 receptors to improve heart rate and contractility, thereby increasing stroke volume and overall cardiac output. This improves tissue perfusion and oxygenation. The other options do not reflect dopamine's primary action. It does not cause vasodilation at therapeutic doses, nor does it reduce oxygen demand or promote fluid retention. Its use must be carefully titrated and monitored in critical care settings for maximum effectiveness and safety. Let us begin with question 29, which focuses on recognizing a serious complication after a myocardial infarction. The nurse is caring for a client who experienced a myocardial infarction 24 hours ago. The question asks, which finding should prompt the nurse to immediately notify the primary healthcare provider? Here are the options. Option A is an elevated troponin level. Option B is a white blood cell count of 13,000 per cubic millimeter. Option C is apprehension about attending cardiac rehabilitation. And option D is crackles auscultated to the midline of the lung fields. The correct answer is option D, crackles auscultated to the midline of the lung fields. Here is the rationale. Crackles at the midline suggest pulmonary edema, a sign of worsening left ventricular failure. This is a potentially life-threatening complication and requires urgent medical evaluation. Elevated troponin and white blood cells are expected findings after an infarction, while apprehension about cardiac rehab is a psychosocial concern, not an immediate physiological threat. Now, let us move to question 30, which addresses psychosocial support for clients adapting to sudden disability. The nurse is caring for a client recovering from a spinal cord injury who is now experiencing emotional distress. The question is, which nursing intervention is most appropriate to support the client's psychosocial well-being during this transition? Here are the options. Option A is administering pain medication. Option B is encouraging self-care. Option C is facilitating a therapeutic conversation to explore feelings. And option D is providing mobility aids. The correct answer is option C, facilitate a therapeutic conversation. Here is the rationale. Emotional support is essential when clients are facing life-altering changes. A therapeutic conversation allows the nurse to listen actively, validate emotions, and offer reassurance. While pain control and promoting independence are important, they do not directly address emotional distress in the way that empathetic communication does. Next comes question 31, focusing on pharmacologic management of peptic ulcer disease. The nurse is caring for a client with a diagnosis of peptic ulcer disease. The question is, which medication should the nurse anticipate being prescribed? The options include option A, ondansetron, option B, difenoxylate with atropine, option C, famotidine, and option D, psyllium. The correct answer is option C, famotidine. Here's the rationale. Famotidine is a histamine 2 receptor antagonist that reduces stomach acid secretion, helping to treat and prevent ulcers. Ondansetron is an antiemetic. Difenoxylate is used for diarrhea, and psyllium is a bulk-forming laxative. None of those options address the underlying acid-related cause of ulcers, making famotidine the appropriate treatment choice. Let us now examine question 32, which reviews the correct timing for Rho-D immune globulin administration. The nurse is educating nursing students on this topic. The question is, which student response indicates correct understanding of the dosing schedule? The options are option A at 12 weeks and within 72 hours of delivery, option B at 28 weeks and within 72 hours of delivery, option C at 25 weeks and within 96 hours of delivery, and option D at 16 weeks and within 12 hours of delivery. The correct answer is option B, at 28 weeks and within 72 hours of delivery. Here is the rationale. RhoGAM is given at 28 weeks to Rh-negative clients to prevent sensitization, and again within 72 hours postpartum if the newborn is Rh positive. This timing is evidence-based and protects future pregnancies from isoimmunization risks. The other answer choices reflect incorrect timing intervals that either occur too early or too late to be effective. Now, let us go to question 33, which focuses on fluid balance assessment in chronic disease. The nurse is admitting a client with chronic kidney disease and congestive heart failure. The question is, which assessment method provides the most accurate indication of the client's fluid balance? Here are the options. Option A is daily weight, option B is intake and output measurement, option C is urine-specific gravity, and option D is serum sodium level. The correct answer is option A, daily weight. Here is the rationale. Daily weights reflect real-time changes in fluid retention or loss. A 1 kilogram weight gain equals approximately 1 liter of fluid. Intake and output tracking can be inaccurate due to poor documentation, while urine-specific gravity is unreliable in renal clients. Serum sodium is influenced by many factors and does not directly indicate fluid volume status. Up next is question 34, which addresses proper technique during enema administration. The nurse is preparing to give a low cleansing enema to a client. The question asks, which action demonstrates proper technique during the procedure? The options are: option A, administer the enema in supine position, option B, insert the enema tube 2 inches, option C, use cold tap water, and option D, hang the enema bag approximately 12 inches above the rectum. The correct answer is option D, hang the enema bag approximately 12 inches above the rectum. Here's the rationale. Hanging the bag at the correct height ensures a gentle and effective flow of solution into the rectum and sigmoid colon. The client should be in the left Sims position, not supine. Insertion depth for an adult should be 3 to 4 inches, and cold water may cause cramping. Proper technique enhances safety and comfort during the procedure. Let us now turn to question 35, which tests knowledge of fetal monitoring during labor. While assessing a laboring client, the nurse observes a temporary fetal heart rate decrease from 150 to 120 beats per minute during a contraction. The question is, how should the nurse classify this fetal heart rate pattern? The options include option A, late deceleration, option B, moderate variability, option C, early deceleration, and option D, marked variability. The correct answer is option C, early deceleration. Here is the rationale. Early decelerations mirror contractions and are typically due to fetal head compression, a normal and non-threatening event during active labor. Late decelerations occur after contractions and are associated with placental insufficiency. Variability refers to beat-to-beat fluctuations, not periodic decelerations. Recognizing early decelerations prevents unnecessary intervention and supports physiologic labor management. Are you ready to finally pass the NCLEX with confidence? Our complete NCLEX course is designed to give you everything you need to succeed. Whether you are starting your prep or need a powerful last-minute boost, you will get access to live classes led by expert nurses, 100 hours of animated crash course content, and over 500 hours of recorded lectures that you can watch anytime. We also cover 500 NGN-style questions in detailed lecture format, along with 5,000 previously asked NCLEX questions to ensure you are fully prepared. Plus, you will get 15 full-length CAT and mock tests that simulate the real exam experience. To support your study plan, we include an exclusive NCLEX ebook, PDF notes, and a personalized study planner for 1 week, 1 month, or 3 months, whichever suits your schedule. And with 1 full year of access after enrollment, you can study at your own pace without stress. This is your shortcut to NCLEX success. So do not wait. Enroll now. Link is in the description. Let us help you become the nurse you are meant to be. Let us now review question 36, which highlights the nurse's role in managing nocturnal enuresis in children. The nurse is counseling parents who are concerned about their child's frequent bedwetting episodes. The question is, which recommendation should the nurse provide to support effective management of this condition? Here are the options. Option A is to establish and maintain a voiding diary. Option B suggests disciplining the child after each episode. Option C recommends using pull-ups routinely at night. And option D advises letting the child go to bed with a full bladder. The correct answer is option A, establish and maintain a voiding diary. Here is the rationale. A voiding diary helps identify patterns in fluid intake, urination, and episodes of enuresis. It supports targeted behavioral strategies and promotes positive parental involvement. Disciplining the child is harmful and counterproductive. Using pull-ups nightly may discourage toilet use, and a full bladder increases the chance of bedwetting. A supportive, structured approach fosters emotional reassurance and long-term improvement. Now, let us move on to question 37, which explores angina classification based on symptom patterns. The nurse is assessing a client with chest pain that occurs at rest and at the same time each day. The question is, which type of angina is the client most likely experiencing? The options are Option A, variant angina, Option B, stable angina, Option C, unstable angina, and Option D, non-anginal pain. The correct answer is Option A, variant angina. Here is the rationale. Variant angina, also known as Prince-Metal's angina, results from coronary artery spasms and often occurs in predictable patterns, especially at rest or during the night. It is treated with calcium channel blockers to prevent vasospasm. Stable angina is exertional and predictable, while unstable angina is unpredictable and emergent. Non-anginal pain stems from musculoskeletal or gastrointestinal issues and does not fit the clinical picture described. Let us now continue with question 38, which emphasizes pre-procedure client education for cardiac stress testing. The nurse is teaching a client scheduled for an exercise electrocardiography test. The question is, which client statement indicates the need for further teaching? The options include Option A, stating they will wear comfortable clothing and shoes, Option B, saying they may have a small cup of coffee before the exam, Option C, affirming their vital signs will be monitored throughout, and Option D, acknowledging they should avoid strenuous activity beforehand. The correct answer is Option B, I may have a small cup of coffee before the exam. Here is the rationale. Caffeine is a stimulant that can interfere with heart rate and skew test results, so it must be avoided for at least 24 hours before a stress test. The other statements reflect accurate understanding of the test preparation and monitoring requirements. Now for question 39, which addresses domestic violence awareness. A nursing student asks why victims often remain in abusive relationships. The question is, which theoretical model best explains the repetitive nature of domestic and spousal abuse? The options are Option A, the cycle of abuse and neglect, Option B, the cycle of violence, Option C, the cycle of impaired couples, and Option D, the Duluth model. The correct answer is Option B, the cycle of violence. Here is the rationale. This model includes 3 repeating phases: tension building, acute explosion, and honeymoon, which explain why victims may feel trapped by fear, guilt, or hope for change. While the Duluth model explains power dynamics, only the cycle of violence outlines the emotional and behavioral patterns that sustain abusive relationships. Are you ready to finally pass the NCLEX with confidence? Our complete NCLEX course is designed to give you everything you need to succeed. Whether you are starting your prep or need a powerful last-minute boost, you will get access to live classes led by expert nurses, 100 hours of animated crash course content, and over 500 hours of recorded lectures that you can watch anytime. We also cover 500 NGN-style questions in detailed lecture format, along with 5,000 previously asked NCLEX questions to ensure you are fully prepared. Plus, you will get 15 full-length CAT and mock tests that simulate the real exam experience. To support your study plan, we include an exclusive NCLEX ebook, PDF notes, and a personalized study planner for 1 week, 1 month, or 3 months, whichever suits your schedule. And with 1 full year of access after enrollment, you can study at your own pace without stress. This is your shortcut to NCLEX success, so do not wait. Enroll now. Link is in the description. Let us help you become the nurse you are meant to be. Moving forward to question 40, we now focus on a neurologic emergency. The nurse observes that a post-stroke client suddenly has a fixed and dilated pupil. The question asks, what is the most appropriate immediate action? The options include Option A, reduce environmental stimuli, Option B, reassess in 10 minutes, Option C, check blood pressure, and Option D, notify the physician. The correct answer is Option D, notify the physician. Here is the rationale. A fixed and dilated pupil may indicate increased intracranial pressure or brain herniation. This is a medical emergency that requires immediate action. The other responses may be appropriate in routine neurologic care, but are insufficient for managing a potentially fatal complication. Let us now examine question 41, which tests pharmacology knowledge. The nurse receives a new prescription for apixaban. The question is, this medication is primarily prescribed to treat which condition? The options are option A, pulmonary hypertension, option B, venous thromboembolism, option C, congestive heart failure, and option D, hypertension. The correct answer is option B, venous thromboembolism. Here is the rationale. Apixaban is a direct oral anticoagulant that prevents and treats deep vein thrombosis and pulmonary embolism. It is also used for stroke prevention in atrial fibrillation. It is not indicated for pulmonary hypertension, heart failure, or as a blood pressure medication. Now we come to question 42, which focuses on hypertension management in pediatric oncology. The question is, which of the following medications may be prescribed to control hypertension associated with nephroblastoma? The options are option A, propranolol, option B, enalapril, option C, nitroprusside, and option D, digoxin. The correct answer is option B, enalapril. Here is the rationale. Enalapril, an angiotensin-converting enzyme inhibitor, blocks the renin-angiotensin-aldosterone system, which is often overactive in nephroblastoma, leading to secondary hypertension. Although monitoring for nephrotoxicity is necessary, ACE inhibitors are the recommended treatment. Propranolol and nitroprusside do not address the hormonal cause of the hypertension, and digoxin is used for heart failure, not for managing blood pressure in this context. Let us now move on to question 43, which focuses on pediatric anesthesia. The nurse is preparing a 3-year-old child for an incision and drainage procedure of a large abscess on the left leg. The question is, which type of anesthesia should the nurse anticipate will be used for this procedure? Here are the options. Option A, peripheral nerve block, option B, spinal anesthesia, option C, general anesthesia, and option D, local anesthesia. The correct answer is option C, general anesthesia. Here is the rationale. General anesthesia is the most appropriate choice for a young child undergoing an invasive and potentially distressing procedure. At 3 years old, the child is unlikely to cooperate fully while awake, and general anesthesia ensures safety, immobility, and pain control throughout the procedure. Peripheral nerve blocks and spinal anesthesia do not provide sedation, and local anesthesia alone would not adequately address the child's anxiety or movement during the surgery. Now for question 44, which addresses safety in opioid administration. The nurse is reviewing the care plan for a client with chronic pain who is receiving morphine sulfate. The question is, which aspect of the plan requires revision? The options are option A, adjust the physician's order based on the client's pain level. Option B, ensure naloxone is always available. Option C, check the client's blood pressure before administering morphine. And option D, provide a high-fiber diet. The correct answer is option A, adjust the physician's order based on the client's pain level. Here is the rationale. Nurses are not authorized to independently modify a physician's prescription. Adjusting opioid dosage requires a provider's order, even if based on valid assessment data. The remaining options reflect appropriate nursing interventions to ensure client safety and manage common side effects of opioid therapy. Let us continue with question 45, which highlights prenatal care and obstetric complications. A 38-week pregnant client arrives at the emergency department reporting vaginal bleeding. The question asks, which statement by the client would most strongly lead the nurse to suspect placenta previa? The options include option A, I do not feel any pain at all. It is just the bleeding that concerns me. Option B, I feel like I'm about to go into labor. My tummy is starting to contract. Option C, I started bleeding when I picked up my 3-year-old son. And option D, I feel like I am about to vomit. The correct answer is option A, I do not feel any pain at all. It is just the bleeding that concerns me. Here is the rationale. Placenta previa presents with painless, bright red vaginal bleeding in the 3rd trimester. The absence of pain is a classic distinguishing feature. Other responses, such as contractions or lifting a child, are not specific indicators of placenta previa. Now let us look at question 46, which is a prioritization and skills-based item. The nurse is preparing to suction a client with a tracheostomy. The question asks, arrange the steps of tracheostomy suctioning in the correct order. Suction the client as the catheter is removed for a maximum of 15 seconds. Perform hand hygiene and apply personal protective equipment, PPE. Apply Apply sterile gloves. Using an aseptic technique, open the suction kit or catheter package and prepare supplies. Test the suction catheter in sterile saline. Apply a continuous pulse oximeter to the client. Identify the client, perform hand hygiene, and gather supplies. The correct sequence is 1. Identify the client, perform hand hygiene, and gather supplies. 2. Apply a continuous pulse oximeter to the client. 3. Perform hand hygiene and apply personal protective equipment. 4. Using aseptic technique, open the suction kit and prepare supplies. 5. Apply sterile gloves. 6. Test the suction catheter in sterile saline. 7. Suction the client as the catheter is withdrawn, not exceeding 15 seconds. This procedure must be performed with strict attention to infection control and oxygenation safety. Monitoring oxygen saturation, maintaining sterile technique, and limiting suction duration all reduce the risk of hypoxia and infection. Moving forward to question 47, we turn to the pharmacodynamics of norepinephrine. The nurse is caring for a client receiving a norepinephrine infusion. The question is, which statement most accurately describes the pharmacological action of norepinephrine? The options are: Option A, it regulates mood and emotions. Option B, it is produced by the adrenal cortex. Option C, it is released by postganglionic sympathetic neurons and acts on adrenergic receptors. And Option D, it is secreted by the posterior pituitary gland. The correct answer is Option C, norepinephrine is released by postganglionic sympathetic neurons and acts on adrenergic receptors. Here is the rationale. Norepinephrine is a potent vasopressor and neurotransmitter in the sympathetic nervous system. It stimulates primarily alpha-adrenergic receptors to cause vasoconstriction and increase blood pressure. This mechanism is critical in managing shock and severe hypotension. The other options confuse norepinephrine with hormones or neurotransmitters not related to sympathetic vascular regulation. Question 48 begins with an obstetric emergency during labor. The nurse is caring for a laboring client who is experiencing variable decelerations, and upon assessment, the nurse observes the umbilical cord protruding through the vagina. The nurse must act immediately. Which of the following actions should the nurse take, in order, from first to last? Here are the options. Prepare the client for immediate cesarean delivery. Apply pressure to lift the presenting fetal part. Administer oxygen via face mask. Place the client in the Trendelenburg position and stay with the client and call for help. The correct order is as follows. First, apply pressure to lift the presenting fetal part. Second, stay with the client and call for help. Third, place the client in the Trendelenburg position. Fourth, administer oxygen via face mask. And finally, prepare the client for immediate cesarean delivery. Here is the rationale. The most critical initial action when a prolapsed umbilical cord is identified is to relieve pressure from the cord by manually elevating the presenting fetal part. This prevents further cord compression and preserves fetal oxygenation. The nurse must then remain with the client and immediately summon help, as this is a true obstetric emergency. Next, the nurse should position the client in the Trendelenburg or knee chest position to use gravity to further reduce pressure on the cord. Administering oxygen at 8 to 10 liters per minute by face mask helps maximize maternal and fetal oxygenation. Lastly, the nurse should assist in preparing the client for an emergency cesarean delivery, which is the definitive management to prevent fetal hypoxia or death. Key clinical insight: never attempt to push the cord back into the uterus. Instead, maintain decompression, keep the cord moist, and respond rapidly with team support. Question 49 now shifts to a routine prenatal assessment. The nurse is evaluating a client during her initial prenatal visit and notes the presence of Chadwick's sign. How should the nurse interpret this finding? Here are the options. A. A blue to purplish hue of the cervix. B. Softness to the uterine fundus felt through the abdomen. C. A thinning and lengthening of the cervix. Or D. The absence of menstruation at day 28 in a woman's cycle. The correct answer is Option A. A blue to purplish hue of the cervix. Here is the rationale. Chadwick's sign is a probable sign of pregnancy, identified by bluish to purplish discoloration of the cervix, vagina, and labia, due to increased blood flow and venous congestion. It typically appears between 6 to 8 weeks of gestation and is noted during pelvic examination. Clinical teaching tip: probable signs like Chadwick's, Hegar's, and Goodell's signs are suggestive but not diagnostic. Only positive signs such as fetal heart tones, and ultrasound confirm pregnancy. Caring for a client experiencing a vaso-occlusive event related to sickle cell disease. Which of the following findings would indicate that the client is responding positively to treatment? Here are the options. A. Decreased self-report of pain. B. Increased white blood cell count. C. Decreased energy while ambulating. Or D. Increased skin tenting in the sternum. The correct answer is option A, decreased self-report of pain. Here is the rationale. Pain is the hallmark symptom of a vaso-occlusive crisis, caused by ischemia from obstructed capillaries. When the client reports a decrease in pain, it suggests that treatment, such as intravenous fluids, opioid analgesia, and oxygen, is effective. In contrast, an increased white blood cell count is commonly associated with inflammation during a crisis and does not indicate improvement. Decreased energy is a chronic symptom in sickle cell disease and not a reliable sign of treatment response. Increased skin tenting signals dehydration, which actually worsens a vaso-occlusive crisis. Bottom line, pain relief is a primary goal and a key indicator of recovery in vaso-occlusive episodes. Question 51 takes us into medication administration for asthma management. A nurse is preparing to administer tiotropium bromide capsules to a client with asthma. What is the most important action the nurse should take to ensure proper delivery of this medication? Here are the options. A. Administer the medication with a spacer to improve delivery to the lungs. B. Instruct the client to take a quick, shallow breath after activating the inhaler. C. Ensure the client holds their breath for at least 10 seconds after inhaling the medication. Or D. Monitor the client's serum potassium levels before and after administration. The correct answer is option C. Ensure the client holds their breath for at least 10 seconds after inhaling the medication. Here is the rationale. Tiotropium is a long-acting anticholinergic bronchodilator delivered via a dry powder inhaler. Proper inhalation technique is essential for effective drug delivery, and holding the breath after inhalation allows the medication to reach the lower airways. Spacers are used for metered dose inhalers, not dry powder inhalers. A quick, shallow breath is not effective for dry powder inhalers. Instead, clients should take a slow, deep breath. Monitoring potassium levels is unnecessary with tiotropium, as it does not affect electrolyte balance. Question 52 starts with a scenario involving a client diagnosed with infective endocarditis. The nurse is caring for this client and must anticipate the appropriate medication that is likely to be prescribed. Here are the options. A. Nitroglycerin, B. Vancomycin, C. Atorvastatin, or D. Aspirin. The correct answer is option B. Vancomycin. Here is the rationale. Vancomycin is a broad-spectrum antibiotic and is commonly administered to treat infective endocarditis, especially while awaiting blood culture results. This powerful antibiotic targets gram-positive organisms, including Staphylococcus aureus, which is a frequent culprit in endocarditis. The nurse must obtain blood cultures before starting this medication, but empirical therapy is initiated promptly to reduce the risk of complications such as septic emboli. On the other hand, nitroglycerin, atorvastatin, and aspirin are not first-line treatments for this condition and would not address the underlying infection. Now, let us move on to question 53, which focuses on identifying signs of fecal impaction in an older adult. An 83-year-old client who has not had a bowel movement in 5 days is being assessed, and the nurse suspects fecal impaction. The question is, which finding would be most indicative of this condition? Here are the options. A. Rigid board-like abdomen. B. The client has lost the urge to defecate. C. Liquid stools. Or D. Complaints of abdominal pain without distension. The correct answer is option C. Liquid stools. Here is the rationale. In older adults, especially those who are immobile or have decreased bowel motility, liquid stools may be the only outward sign of a fecal impaction. This phenomenon, known as paradoxical diarrhea, occurs when liquid stool seeps around the impacted fecal mass. Although it may appear that the client is experiencing diarrhea, it is actually a sign of significant blockage. A rigid abdomen is more consistent with an acute surgical abdomen, like peritonitis. Loss of the urge to defecate is not typical. And abdominal pain without distension is nonspecific. Question 54 shifts focus to cardiac care, specifically the symptoms of left-sided heart failure. A client presents to the emergency department with fatigue, shortness of breath, and is observed sitting in a tripod position with frequent coughing. The nurse understands that the respiratory symptoms seen in left-sided heart failure are primarily caused by which of the following? Here are the options. A. There is venous congestion in the liver. B. There is hypoperfusion of tissue cells. C. There is pulmonary congestion. Or D. Despite normal cardiac output, the heart cannot meet the accelerated demands of the body. The correct answer is option C. There is pulmonary congestion. Here is the rationale. In left-sided heart failure, the left ventricle cannot effectively pump blood forward into systemic circulation. This causes blood to back up into the pulmonary circulation, increasing capillary hydrostatic pressure and leading to fluid leakage into the alveoli. The result is classic respiratory symptoms such as dyspnea, orthopnea, coughing, and crackles. The tripod position is a compensatory mechanism to facilitate breathing in response to this congestion. In contrast, liver congestion is a feature of right-sided heart failure. And while hypoperfusion and high-output failure are considerations, they do not directly cause pulmonary symptoms. Finally, question 55 brings us to medication monitoring in oncology care. The nurse is caring for a client receiving oprelvekin, a thrombopoietic growth factor, and needs to evaluate whether the medication is having its intended effect. Here are the options. A. Hemoglobin 14 grams per deciliter. B. White blood cell count 6,500 per cubic millimeter. C. Platelet count 155,000 per cubic millimeter. Or D. Prothrombin time 11 seconds. The correct answer is option C. Platelet count 155,000 per cubic millimeter. Here is the rationale. Oprelvekin is prescribed to increase platelet production in clients at risk for chemotherapy-induced thrombocytopenia. A platelet count within the normal range, like 155,000, indicates the drug is effective in restoring adequate platelet levels and reducing bleeding risk. While the other lab values are normal and clinically relevant, they do not reflect the therapeutic goal of this particular medication. Hemoglobin and white blood cell counts are unaffected by oprelvekin, and prothrombin time reflects coagulation, not platelet production. Are you ready to finally pass the NCLEX with confidence? Our complete NCLEX course is designed to give you everything you need to succeed. Whether you are starting your prep or need a powerful last-minute boost, you will get access to live classes led by expert nurses, 100 hours of animated crash course content, and over 500 hours of recorded lectures that you can watch anytime. We also cover 500 nclex-style questions in detailed lecture format, along with 5,000 previously asked nclex questions to ensure you are fully prepared. Plus, you will get 15 full-length CAT and mock tests that simulate the real exam experience. To support your study plan, we include an exclusive NCLEX ebook, PDF notes, and a personalized study planner for 1 week, 1 month, or 3 months, whichever suits your schedule. And with 1 full year of access after enrollment, you can study at your own pace without stress. This is your shortcut to NCLEX success, so do not wait. Enroll now. Link is in the description. Let us help you become the nurse you are meant to be. Question 56 begins with a respiratory infection scenario requiring diagnostic accuracy. A client has been admitted with a persistent cough, chills, and fever, and the admission orders include a regular diet, vital signs every 4 hours, ampicillin 250 milligrams by mouth every 6 hours, and a sputum culture. Before starting antibiotic therapy, which nursing action should take priority? Here are the options. A. Provide the client a full meal. B. Collect the sputum sample. C. Assess the client's vital signs. Or D. Assess the client's oxygen saturation. The correct answer is option B. Collect the sputum sample. Here's the rationale. The sputum culture must be obtained before starting antibiotic therapy to avoid compromising the accuracy of the culture results. If antibiotics are administered beforehand, they can suppress or alter the growth of bacteria, potentially leading to a false negative or incorrect diagnosis. Providing a meal is not a priority here, especially because ampicillin is best absorbed on an empty stomach. Checking vital signs and oxygen saturation are essential for overall monitoring, but they do not take precedence over obtaining a diagnostic culture before treatment begins. Question 57 now brings us to a nutrition-related concern in a burn client receiving total parenteral nutrition. The nurse introduces herself to a severely burned client who asks about the bag of intravenous fluid hanging at the bedside, referring to total parenteral nutrition. How should the nurse respond? Here are the options. A. I do not think you should be getting this. I'm going to call your doctor. B. This is total parenteral nutrition, and you are getting it because your nutritional status is impaired as the result of your burns. C. This is total parenteral nutrition, and you are getting it because you are not eating enough. Or D. I do not think you should be getting this. I am going to turn it off now. The correct answer is option B. This is total parenteral nutrition, and you are getting it because your nutritional status is impaired as the result of your burns. Here is the rationale. Clients with severe burns experience increased metabolic demands due to the body's efforts to repair damaged tissue. TPN provides vital nutrients, calories, and protein necessary for healing when oral or enteral intake is inadequate. This response communicates both the purpose and rationale clearly and professionally. Saying the client is not eating enough oversimplifies the reason and lacks clinical context, while suggesting to call the doctor or turning it off indicates inappropriate practice and undermines nursing accountability. Question 58 now explores stroke localization by examining neurological deficits. The nurse is caring for a client who recently experienced a stroke affecting the occipital lobe. Which of the following assessment findings would most accurately support this diagnosis? Here are the options. A. Homonymous hemianopia. B. Impaired proprioception. C. Expressive aphasia. Or D. Impulsivity. The correct answer is option A. Homonymous hemianopia. Here is the rationale. The occipital lobe is the brain's primary center for visual processing. Damage to this region often results in visual field deficits like homonymous hemianopia, where the same side of each eye loses vision. This condition significantly affects daily function and safety, and clients must be taught to scan their environment to compensate. Impaired proprioception points to parietal lobe injury. Expressive aphasia stems from damage to Broca's area in the frontal lobe, and impulsivity typically occurs with frontal lobe impairment. Question 59 focuses on transfusion safety measures prior to administering fresh frozen plasma. The nurse is preparing to infuse fresh frozen plasma, also known as FFP, and needs to ensure proper preparation before starting the transfusion. Which of the following is the most appropriate action? Here are the options. A. Obtain baseline platelet count. B. Verify ABO compatibility. C. Infuse over 2 to 4 hours. Or D. Obtain a 12-lead electrocardiogram. The correct answer is option B, verify ABO compatibility. Here is the rationale. Even though FFP does not contain red blood cells, it does contain antibodies that can react with the recipient's blood type, leading to hemolytic reactions. Therefore, verifying ABO compatibility is mandatory before FFP transfusion. A platelet count is not necessary here, as FFP is not used to replace platelets. Infusing over 2 to 4 hours is appropriate for packed red blood cells, but FFP should typically be infused over 15 to 30 minutes to minimize clotting factor degradation. An electrocardiogram is not routinely required unless the client has pre-existing cardiac conditions. Key safety point: always confirm ABO compatibility and closely monitor for transfusion reactions when administering any blood product. Question 60 transitions us into labor and delivery management involving slow progression. The nurse is caring for a client experiencing labor dystocia, characterized by slow or stalled labor progress. In this scenario, which medication does the nurse anticipate the healthcare provider will prescribe to promote labor? Here are the options. A. Oxytocin. B. Terbutaline. C. Magnesium sulfate. Or D. Betamethasone. The correct answer is option A. Oxytocin. Here is the rationale. Oxytocin is a uterotonic agent commonly used to induce or augment labor by increasing the strength and frequency of uterine contractions. It is the go-to medication in cases of labor dystocia, when contractions are inadequate to promote cervical dilation and fetal descent. Terbutaline is a tocolytic that inhibits contractions, typically used to delay preterm labor. Magnesium sulfate is primarily used for seizure prevention in preeclampsia or as a tocolytic, not for stimulating labor. Betamethasone is a corticosteroid administered during preterm labor to accelerate fetal lung maturity, not for addressing labor dystocia. Question 61 brings us to a critical post-procedure scenario involving volume management after paracentesis. The nurse is caring for a client who has just undergone a large volume paracentesis. To prevent hypovolemic shock, which type of infusion should the nurse anticipate the healthcare provider will prescribe? Here are the options. A. 0.9% saline, B. albumin, C. mannitol, or D. 0.45% saline? The correct answer is option B, albumin. Here is the rationale. Albumin is a colloid solution that maintains oncotic pressure and draws fluid back into the vascular space following the removal of large volumes of acidic fluid. When more than 5 liters of fluid are drained, there is a high risk of circulatory collapse due to intravascular fluid shifts. Albumin helps prevent this by pulling interstitial fluid into the bloodstream, stabilizing blood pressure, and preventing hypovolemia. Although normal saline can expand volume, it is not as effective as albumin for large volume loss. Mannitol is used to reduce intracranial pressure, not replace fluid, and 0.45% saline is hypotonic, primarily hydrating cells rather than expanding plasma volume. Question 62 now transitions into ethical nursing practice in behavioral health. A nurse is caring for a client who has been involuntarily admitted to a behavioral health unit. During the shift, a postal package arrives addressed to the client. What is the most appropriate action for the nurse to take? Here are the options. A. Provide the client with the package. B. Open the package to review its content. C. Provide the package upon discharge. Or D. Determine if the sender is the client's next of kin. The correct answer is option A. Provide the client with the package. Here is the rationale. Even clients under involuntary admission retain their civil rights, including the right to receive unopened personal mail. Denying or tampering with a package without cause is a violation of the Patient Bill of Rights and may compromise the nurse-client relationship. If safety is a concern, the nurse can request that the client open the package in their presence, but the package should never be opened without permission. Holding the package until discharge or screening it based on sender identity is inappropriate and could be legally and ethically challenged. Question 63 brings us to a culturally sensitive moment centered around religious dietary practices. The nurse is caring for a client who follows a kosher diet. An especially prepared kosher meal has just been delivered. What is the most appropriate action the nurse should take next? Here are the options. A. Withhold any liquids until after the meal. B. Assist the client in unwrapping the utensils. C. Remove any condiments such as salt and pepper. Or D. Allow the client to unwrap the utensils. The correct answer is option D. Allow the client to unwrap the utensils. Here is the rationale. Kosher meals are often sealed and come with wrapped utensils to ensure ritual cleanliness. To maintain the kosher status of the meal, only the client should unwrap or touch the utensils and packaging. While offering help may seem courteous, it could violate the client's religious dietary rules. Withholding liquids is unnecessary unless the beverage itself conflicts with dietary restrictions, and condiments such as salt and pepper are typically permitted. Question 64 shifts our focus to a foundational clinical skill: performing an abdominal assessment in the correct order. The nurse is observing a student nurse who is assessing a client with gastroenteritis. Which sequence indicates the student is using proper technique? Here are the options. A. Auscultation, inspection, palpation, percussion. B. Inspection, palpation, percussion, auscultation. C. Palpation, percussion, inspection, auscultation. Or D. Inspection, auscultation, percussion, palpation. The correct answer is option D, inspection, auscultation, percussion, palpation. Here is the rationale. The proper sequence of abdominal assessment begins with inspection, followed by auscultation before any touching of the abdomen. This is critical because palpation or percussion can stimulate bowel activity, which might alter the sound pattern and lead to inaccurate findings during auscultation. Starting with visual inspection allows the nurse to observe for distension, skin changes, or peristalsis. The other options disrupt this sequence and can compromise the integrity of the assessment. Question 65 brings us into a common concern during the second trimester of pregnancy. A primigravida client contacts the obstetrics clinic and reports noticing a dark line developing along the center of her abdomen. As the triage nurse, which of the following findings best explains this physiological change? Here are the options. A. Cloasma. B. Linea nigra. C. Goodell sign. Or D. Striae gravidarum. The correct answer is option B, Linea nigra. Here is the rationale. Linea nigra is a normal skin change that appears during pregnancy, usually in the second trimester. It manifests as a dark vertical line running from the sternum or umbilicus down to the pubic area and results from increased production of melanocyte-stimulating hormone. This pigmentation is especially noticeable in individuals with darker complexions and is completely harmless. Cloasma, or the mask of pregnancy, affects the face and not the abdomen. Goodell's sign refers to softening of the cervix and is not visible externally. Striae gravidarum are stretch marks, which appear as streaks, not as a single vertical line. Question 66 focuses on proper medication administration to reduce systemic absorption. The nurse is providing discharge education to a client who has been prescribed eye drops. To minimize the systemic absorption of the medication, which instruction should the nurse include? Here are the options. A. Instill the eye drops before meals. B. Swallow several times after instilling the eye drops. C. Blink rapidly after instilling the eye drops. Or D. Apply gentle pressure over the inner canthus for 30 to 60 seconds after administration. The correct answer is option D. Apply gentle pressure over the inner canthus for 30 to 60 seconds after administration. Here is the rationale. Applying pressure to the inner corner of the eye occludes the nasolacrimal duct, preventing systemic absorption of the medication through the nasal mucosa. This ensures that the drug remains localized and reduces the risk of unwanted systemic side effects. Timing with meals and swallowing are irrelevant to ocular absorption, while blinking vigorously may expel the medication. Are you ready to finally pass the NCLEX with confidence? Our complete NCLEX course is designed to give you everything you need to succeed. Whether you are starting your prep or need a powerful last-minute boost, you will get access to live classes led by expert nurses, 100 hours of animated crash course content, and over 500 hours of recorded lectures that you can watch anytime. We also cover 500 NGN-style questions in detailed lecture format, along with 5,000 previously asked NCLEX questions to ensure you are fully prepared. Plus, you will get 15 full-length CAT and mock tests that simulate the real exam experience. To support your study plan, we include an exclusive NCLEX ebook, PDF notes, and a personalized study planner for 1 week, 1 month, or 3 months, whichever suits your schedule. And with 1 full year of access after enrollment, you can study at your own pace without stress. This is your shortcut to NCLEX success. So, do not wait. Enroll now. Link is in the description. Let us help you become the nurse you are meant to be. Question 67 highlights pharmacologic reversal in toxicology emergencies. A client arrives in the emergency department following an overdose of lorazepam. Which medication should the nurse anticipate the healthcare provider will prescribe? Here are the options. A. Flumazenil, B. Phenylephrine, C. Epinephrine, or D. Naloxone. The correct answer is option A. Flumazenil. Here is the rationale. Flumazenil is a benzodiazepine receptor antagonist and the specific antidote used to reverse the sedative effects of benzodiazepines, such as lorazepam. It acts quickly to restore central nervous system function. Phenylephrine is used as a decongestant. Epinephrine is indicated for anaphylaxis and cardiac arrest, and naloxone is effective for opioid overdoses, not benzodiazepines. Clinical Pearl. Always differentiate which reversal agents correspond to which class of medications in toxicology scenarios. Question 68 turns our attention to anticoagulation therapy. The nurse receives a new prescription for rivaroxaban. This medication is typically used to treat which condition? Here are the options. A. Pulmonary hypertension. B. Venous thromboembolism. C. Congestive heart failure. Or D. Hyperlipidemia. The correct answer is option B, venous thromboembolism. Here is the rationale. Rivaroxaban is a direct factor XA inhibitor that is commonly prescribed to treat and prevent venous thromboembolism, including deep vein thrombosis and pulmonary embolism. It is also used to reduce stroke risk in atrial fibrillation. It is not used for pulmonary hypertension, heart failure, or hyperlipidemia. Here is additional insight. Rivaroxaban does not require routine lab monitoring and has an antidote called andexanet alpha, which may be used in cases of bleeding. Question 69 transitions into emergency care for burn clients. A client with 18% full-thickness burns is being treated in the emergency department. What is the nurse's primary goal during the emergent or resuscitation phase of burn management? Here are the options. A. Collaborate with physical and occupational therapy. B. Provide outpatient follow-up referrals. C. Begin parenteral nutrition. Or D. Initiate intravenous fluid replacement. The correct answer is option D. Initiate intravenous fluid replacement. Here is the rationale. The emergent phase of burn management focuses on airway stabilization and rapid fluid resuscitation. Significant burns result in massive fluid shifts that lead to hypovolemia and shock. Timely administration of intravenous fluids is crucial to maintaining perfusion and organ function, while physical therapy, nutrition, and referrals are essential. Later on, they are not priorities in the first 24 to 48 hours. Burn care priority. Always stabilize circulation first in major burns through fluid resuscitation, using formulas like the Parkland formula when indicated. Question 70 addresses a common concern regarding pain management and narcotic use. A client in severe pain is hesitant to take a prescribed narcotic, expressing fears of addiction. How should the nurse respond? Here are the options. A. That is ridiculous. Nobody gets addicted without a prior history of drug abuse. B. The possible complications of unrelieved pain greatly outweigh the risk of addiction, which is very low for those without a history of substance abuse. C. Many people prefer to tough it out, so you are not alone. Or D. It is your right to refuse, so you can just go without it. The correct answer is option B. The possible complications of unrelieved pain greatly outweigh the risk of addiction, which is very low for those without a history of substance abuse. Here is the rationale. This response is therapeutic, informative, and evidence-based. It validates the client's concern while offering reassurance and education. Pain that is untreated can have physiological and psychological consequences. The other responses are dismissive, non-educational, or lack empathy. Clinical teaching point. Nurses must always balance compassionate care with clinical accuracy, helping clients feel heard while promoting safe and effective symptom relief. Let us now shift into question 71 that represent the A reproductive emergency that can present subtly but lead to life-threatening consequences if missed. A nurse in the emergency department is assessing a 7-week pregnant client who reports lower abdominal pain, vaginal spotting, and left shoulder pain. The client appears anxious, has a heart rate of 112 beats per minute, and a blood pressure of 90/60 millimeters of mercury. Based on these findings, which of the following complications should the nurse suspect? Consider the options: A. Threatened abortion, B. Hyperemesis gravidarum, C. Ectopic pregnancy with possible rupture, D. Urinary tract infection. The correct on C is C. Ectopic pregnancy with possible rupture. Here is the rationale. These signs point to a potentially ruptured ectopic pregnancy, a life-threatening condition where the fertilized egg implants outside the uterus. Commonly in the fallopian tube, shoulder pain is a referred pain from diaphragmatic irritation due to internal bleeding, and the presence of hypotension and tachycardia suggests hypovolemic shock. Immediate intervention is required to prevent maternal collapse. Let us turn our attention to a condition that continues to affect millions of children worldwide and demands close clinical observation. Question 72. A nurse is assessing a 3-year-old child from a low-income community who presents with muscle wasting, a distended abdomen, thinning hair, and irritability. The child's weight is significantly below the 5th percentile for age, and the serum albumin level is low. Based on these findings, which of the following diagnoses is most likely? Let's see the options: A. Marasmus, B. Kwashiorkor, C. Celiac disease, D. Iron deficiency anemia. The correct answer is B. Kwashiorkor. Here is the rationale. Kwashiorkor is a form of protein energy malnutrition that occurs due to severe protein deficiency despite adequate caloric intake. Hallmark signs include edema, which causes a falsely reassuring appearance of chubbiness, a distended abdomen, flaky or peeling skin, thin hair, and irritability. The low serum albumin level further confirms protein deficiency. Unlike marasmus, where there is total calorie deprivation, kwashiorkor primarily involves inadequate protein with sufficient calories. Moving into another common concern during early pregnancy, question 73, the nurse is caring for a client who is 10 weeks pregnant and reports moderate vaginal bleeding with mild cramping. On pelvic examination, the cervix is found to be closed, and the ultrasound confirms a viable intrauterine pregnancy. Based on these findings, which type of spontaneous abortion is most likely occurring? Here are options: A. Incomplete abortion, B. Missed abortion, C. Inevitable abortion, D. Threatened abortion. Correct answer is D. Threatened abortion. Here is the rationale. A threatened abortion refers to the presence of vaginal bleeding in early pregnancy, typically before 20 weeks gestation. with a closed cervical os and a viable fetus still detected on ultrasound. The uterus may be tender, and the client may report mild cramping. However, since the cervix remains closed and the fetus is still alive, the pregnancy may continue with proper monitoring and rest. Let us explore a foundational concept in maternal and newborn nursing that plays a vital role in postpartum care. Question 74. The nurse is educating a new mother on how breastfeeding works. Which of the following hormones is primarily responsible for the milk ejection reflex during lactation? Consider the options: A. Prolactin, B. Oxytocin, C. Estrogen, D. Progesterone. The correct answer is B. Oxytocin. Here's the rationale. Oxytocin is the hormone responsible for the milk ejection reflex, also known as the let-down reflex. When the infant suckles at the breast, sensory signals travel to the hypothalamus, prompting the posterior pituitary gland to release oxytocin. This causes the smooth muscle cells surrounding the alveoli and the mammary glands to contract, propelling milk through the ducts and out of the nipple. Finally, let us wrap up this session with our last scenario that focus on a critical neurological concern seen in infants, one that requires early detection to prevent long-term complications. Question 75. The nurse is assessing a 3-month-old infant during a routine well baby visit. Which of the following findings would be most concerning and suggest possible hydrocephalus? See the options. A. Soft anterior fontanelle and good head control. B. Head circumference in the 50th percentile. C. Sun-setting eyes and bulging fontanelle. D. Strong rooting and sucking reflexes. Correct answer is C. Sun-setting eyes and bulging fontanelle. Here is the rationale. A bulging fontanelle and sun-setting eyes, where the eyes appear driven downward with the sclera visible above the iris, are hallmark signs of increased intracranial pressure due to hydrocephalus. This condition involves an abnormal accumulation of cerebrospinal fluid in the ventricles of the brain, often resulting in rapid head growth, irritability, poor feeding, and changes in neurological status. These signs warrant immediate evaluation. Thank you for watching, and we will see you in the next video.